Yeah! Oh,
Jeez.
hallelujah.
I know, right? Sorry. I don't even know what happened. Just telling me slowed connection, oh God, awful.
It was just one thing after the other. And I was like, is this going to happen today? Like, no, please, God.
Yeah, always happens. Yeah.
Oh, gosh. All right. So I can see that you were your scrub. So that means you are actually in the hospital right now, aren't you?
Yeah, but, what I'm trying to do is sort out the pile of paperwork I've got before I go home. So that I don't have to, I don't have to do a lot of stuff tomorrow.
Yeah, definitely. Okay, yeah. So I'm going to get you to introduce yourself, who you are, your name, and what you do, and then we're going to get into it. All right, go ahead.
Okay, so my name is Andrew Folusho Alalade. I'm a neurosurgeon, so basically I operate on people's brains and spine. My subspecialty is mainly on the brain, though. So blood vessels and then complex brain tumors. So that's what I do.
Gosh, that is so great. And how long have you been doing this for now?
Pretty much since 2005. I only became a consultant last year, but it's a long training process. So pretty much took about 10, 12 years of my life in total, 14, yeah.
Jeez, wow, that is crazy. And now like consulting, I guess consulting is just like that level where like, yeah.
I don't know about that. Everybody keeps saying, oh, what else are you going for now? Are you going to be a professor? Are you going to be, you're never satisfied? I don't know. We just keep going. Yeah.
Yeah. So obviously, you're a specialist for like brain,
hi guys, Smiley.
And all that kind of stuff. So what's that like operating on the brain? Like that must be like, do you ever get scared or like handshake? Because obviously this stuff takes a lot of delicate care. So like, how are you before like, just tell us.
Yeah. So my story is a bit of a funny one because I've always wanted to be a neurosurgeon since I was about 13. So it's kind of odd because what do you even know about it? I can remember sitting in a science class and some science teacher was talking about the brain, the spine, and I was just fascinated. And then as the years went by, people you hear about gifted hands, when Ben Carson was still really popular. And I used to have a picture of him on my wall, and my mom used to be like, what's wrong with this kid, So that for me was a big deal at the time. And I can remember having a dream about operating on different people, like coming into clinic, giving them good news after you've operated. And then, this was when I was maybe in high school. And then going to med school. And then the second year of med school, my dad got diagnosed with a brain tumor. So, and then it was a really tough time. My mom just, it was really tough, the whole family. But then he had surgery and he was fine. And I can remember introducing myself to the surgeon who operated on him at the time and saying, I want to be a neurosurgeon. What do you advise? It was a Swedish neurosurgery consultant in London. And I sent him an email. I said, I want to be a neurosurgeon. Can you give me an advice? And it was when Yahoo Mail was still, the early days. I've still got the email somewhere. So when my dad, this is a really long time. This is about 20 plus years ago. So now my dad is fine. We chat about it all the time. So about 10 years or so after the surgery, this was 2000 and I don't know, maybe about 6-7 years ago. I actually went with my dad in a follow-up clinic consultation to see this consultant. So he was so excited, he took me around. He was like, oh, this guy sent me an email, blah, 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 years ago. It was really cool.
And look at you now, you're actually that surgeon and like you did it.
I know. It's like a dream, isn't it? A dream come true.
Yeah. Definitely. Wow, amazing. Gosh, man, like I salute you, man. Like dealing with the brain and into the spine, because those are the main functionality of how like we move, connect everything. So I guess having the privilege to be able to work on something like that to give someone life must be like kind of like, ooh, this is,
and then coming back to your question about how do you feel, one thing I've realized being a neurosurgeon is you've got to be cool regardless of the circumstances. And I've had some really hairy moments, but I know that my psyche and my emotional, stability is what a lot of people in the theater are dependent on. If you're a surgeon who suddenly says, "Oh shit," or stuff, the fear gets transmitted around. So they've had, there've been a lot of really hairy moments. Maybe there's more bleeding than you expect, but you've got to keep a really cool head and let your nurses, the anesthetist, everybody know that you've got things under control, because that's how they trust you. You see, because if they see you shake and stuff, nobody will want to be in theater with you again. Nobody.
We're not going there again.
Nobody. And
so
then
you almost have to be a leader with confidence. You have to lead with confidence, and you have to know that I've got this, so that everybody else can it filters down, so everybody else has the confidence to be able to do what you're doing. My goodness me, that's crazy. Absolutely, wow, amazing. Okay, so you're a surgeon, and you are considered as a frontline staff, because you're a key worker. You help people to get better. How has COVID-19 affected you in terms of your working and the surgeries you have to do? Have you been pulled away from there, or Oh, sorry, someone just asked, is Andy a Christian? Yes.
I am a Christian. Yeah,
he is a Christian. Yeah, everybody that you see.
Yeah, it's quite. I understand, and I know when you were talking to the anesthetist yesterday. Sometimes it's difficult, isn't it? The Christian faith with with science, and especially when you're dealing with neurosurgery, when you see really bad cases, it tests your faith a lot. Coming up to COVID, we're regarded as frontline staff. I actually regard my anesthetic colleagues as being more frontline than I am. So like Desire yesterday, who you were speaking to, because, that's Tommy, who's just come up. One of my friends is a critical care doctor as well. So I actually regard them as being more frontline than I am. How has this impacted on my practice? We are not doing a lot of elective cases, so cases that have to that are not urgent and are not emergency surgeries. We've had to put everything on hold. In my hospital, we're only doing emergencies, things that really, really need to be done urgently. Maybe life-threatening, or brain tumors that are maybe causing some weakness or some visual problems, or seizures, or made a patient really unconscious. So early this week, it was a bit light, but over the last 3 days, I've operated every day. So, and it's more challenging because you're pretty much going in like an astronaut now. So you're just all hot because of the kit. You've got to wear the goggles, you've got to wear the mask, you've got to wear everything. You're operating under the microscope. It's more difficult. So that's the major challenge. So a surgery that will pretty much take you maybe 4 hours would now take you maybe about 6, because preparing for it is going to be much longer than what it was like before.
Wow! Oh my gosh! So a 4-hour surgery can take 6 hours to do, because it's because of the kit that you have, like the protective gear. It's not the norm for you to wear during surgery.
Yeah, because now we're beginning to take all cases like they're probably COVID positive, because of the risk, and some of the cases we have to. There's some brain tumors where you operate through the nose, and a few weeks ago There was a lot of information in the neurosurgical community, as well as with the ENT doctors, who are the ear, nose, and throat doctors, that there was a huge risk. And internationally, we'd lost several surgeons who had operated on people through the nose, because, the virus is pretty much within the nasopharynx and the nasal cavity. So you get, a heavy load of it as the anesthetist, as the surgeon, you're getting a heavy load. So, and we think that based on the exposure to the heavy load, there's a correlation with the severity of the viral illness. Which is why, there has been a couple of surgeons who have fallen sick. So now anything that has to do with operating through the nose, we have to do a kind of double check. Do you really need to do that procedure? And if you need to do that procedure, then you've got to really take full precautions, proper precautions. And the hospital staff have been awesome. The management have been awesome. They're thorough checks, making sure. I had a chat with my head of department today, and he was like, his main worry is he does not want anybody to come down with an infection. He doesn't want to lose anyone. So we're doing everything to try our possible best.
Yeah. So with your hospital, was there a lot of preparation involved? Have you guys got your PPEs? Because I know there was a big thing in the news about, hospitals and trusts not receiving their PPEs and still just working with basic equipment, basic protection. So with your trust, do they have that now and able to continue working?
Yeah, it's been a whole kind of evolutionary process. There's always new information. The more information we get, we try to adjust, to be able to counter whatever issues come up, lots of contingency plans. I had to go to our intensive care to look at all the, ventilators to even know how they work, because I'm a surgeon at the end of the day. I don't really deal with ventilators, but there was so much talk about ventilators. So I really wanted to know, what exactly do they do with these ventilators? So at the moment we've got, lined up ventilators. There's been plans to make sure that, we free up ICU as much as we possibly can, so that if people come in and they need ICU beds, then, we have to make sure that there's space for them. There's been talk about redeploying people for maybe surgery, and since we're not operating as much, to move to help our colleagues in intensive care and our colleagues in medicine. And you can see my colleague there saying welcome, because she's in the heat of it. Yeah. So so that's pretty much it. PPEs have been good. We get signed, we get fit tested, checked to make sure that it's appropriate for us and it's good and offering us good maximum protection. So it's been good so far. They've been quite supportive, and all the equipments we've asked for have been provided.
Wow, fantastic. And have you been tested yourself to make sure that you are, okay and everything?
So tested in terms of have I been COVID positive or not? No, I haven't. I guess if I become symptomatic, then yes. And with everything going on, if you cough, if you sneeze, you start thinking, oh my goodness, have I got COVID? And I've been so I haven't. I know last week I felt a bit tired, and I was thinking, but somehow I think most people, especially in the healthcare system, will probably be positive. I think so. With the a lot of people have, probably mild symptoms. Not, many people show symptoms. But I think which is why you can look at the disparity with the UK and the American numbers, because the Americans are testing a lot more people. Are testing a lot more people compared to the numbers so far. And I know there have been, discussions to try and test more people in the UK. But the problem sometimes with testing is, if you test me today, how are you so sure I won't be positive in the next couple of hours?
Right. Okay.
And then, which is why, just like Bizarre said yesterday, that the antibody one might be a bit more helpful, because if you check and, the antibodies are positive, then you can say, are they immune to it? And there's a bit more, liberality in terms of what you can do, who you're exposed to. But at the moment, it's all about staying safe, washing your hands as much as possible, good hygiene. There was some video yesterday about the correlation so far about, the cross-rail figures about how human traffic has reduced significantly at the train stations. And they noticed that it seems to be, some kind of positive correlation. So it's all about making sure that, social distancing, we're keeping away from each other. And hopefully that helps. And like I was telling someone yesterday, I said, if you look at the centuries, if you read through, I like a lot of general knowledge. And I can remember giving a presentation as a medical student on SARS, which was, the virus or the epidemic. I think it was 2003, 2004.
Yeah,
and so they're always, all these epidemics and pandemics every, at least you have 3, 4 every century or so. But now it's just a time where there's a lot of social media, information passes around a bit more. And, we all need to help each other and maintain that social distancing, stay at home, so that we do not, we keep the numbers as low as possible.
Definitely. Gosh. I mean, getting those numbers down seem to be the most important that they're really trying to drive in. And some people just don't want to do that. And I guess the longer they don't, the longer we're in isolation for, right? Is that the thing?
Yeah, exactly. Because the way it is if one person is infected, you come out and let's say you're at a party or something, there are more people, there's a strong chance that, a lot of people are probably going to get infected. So if you keep to yourself, you stay at home as much as possible, you reduce the chances of infecting other people. And it's all about discipline. It's all about discipline. It's all about being considerate. And especially when you tend to hear about colleagues who've lost their lives because of COVID. There's a senior colleague. In fact, in the neurosurgical community, there's one of the really popular neurosurgeons who died about 2 weeks ago. And even in the UK, there's a British Nigerian senior colleague who used to be one of the clinical directors at Princess Alexandra Harlow Hospital, who also died from the COVID infection. So when you know people like that, it tends to, hit home a little bit more. So it's a sad situation, but I hope that very soon, we'll get back to normalcy.
Yeah. And how are your family with all this thing happening? Like, what are their fears and worries about you continuing to work? Is it something that they've had to get used to, or it's just like it's
So family, I'll start from, my wife and kids. I've got 2 kids, an 11-year-old and a 7-year-old. So I'm always a bit worried, and I live far away from home. So I'm usually worried when I get back, make sure, change of clothes, kind of multiple showers before I get home. I don't want to touch anybody when that kind of stuff. But my kids are okay. You tend to be on your guard in case anybody has any symptoms. My wife is a medic as well. So we fall into the key worker thing. So in fact, up to last week, our kids were still going to school. We were very few kids in school, maybe about 4 or 5 in a class. And we got that opportunity because we were both working. And there was nothing else we could do. So we had to apply to the school, and they helped, and sorted us out. My parents, I tell them to stay at home. We just do video calls now. Nobody visits anybody. My mom keeps sending me this typical African mom WhatsApp messages and stuff, and that just kills me. So I keep having to explain on the family group. No, you've got to listen to your son. He's a doctor. Don't just believe all this, Yeah. But it's all good. So many times I get videos from my family members, my parents, my sisters, asking me to, oh, is this right? Is this wrong? Is this right? Is this wrong? So sometimes you don't even know what's true or what's wrong anymore, because there's so much information out there.
I was going to say, because there's a lot of information that's out there, and not all of it is true. A lot of fake news and people trying to, have this fear mongering, just this mentality going on with people. So, what's your advice to people whenever they disseminating such information? When they get something to do with the virus, because the one recently was about some women saying that like the ambulance people won't be able to give any oxygen to this, and it's just nuts. And I'm just like, that ain't never gonna happen. They can't not do that. So what's your advice to people whenever they get such information like that? What's the first thing that they need to do before you start?
It's all about speaking to trusted people. So they're trusted websites as well. And I like what the BBC has done. So the BBC, they put pretty much their updates, regular updates. The NHS provide the 111 helpline, so 111. So if there are any worries, people can call 111. The GPs are getting inundated, but sometimes if your GP is open, there's a lot. There are telephone services across board from different GPs. Even my GP now pretty much runs a kind of telephone service. So if you have any questions to ask, you can ask via the telephone service. But NHS 111 is a good one. The trusted, NHS England websites, Public Health England websites, rather than just anything on Google or WhatsApp or YouTube. That just, is it lemon? Is it turmeric? Do you need to drink hot water? Do you need to gargle hot water? Do you need ginger with a dash of, curry? And there's just so much stuff, and nobody, so it's all about speaking to the trusted people.
Okay. Because there's people are having, sending out videos of concoctions of this will cure the coronavirus. If I take a little bit of lemon, take a bit of ginger, take this, take that. It's just
and I think the worry is because it all stems from the fact that coronavirus, it's a type of it's a flu, isn't it? It's a viral infection. So it's just the way you treat a flu, which is why a lot of people would say, if you have the symptoms and they're quite mild, just stay at home and it would resolve anyway. But then when you start to have things like the main things to look out for, when you start to have, if it's like a persistent cough and you have problems breathing, or you have a fever, because fever can be quite sinister. You're running a temperature 39, 40, tepid sponge, cold showers, nothing seems to help it. Then you've got to go to the hospital. But other than those two, most of the other symptoms, and there are quite a lot of symptoms now, from
now lots of taste,
muscle pain, loss of taste, loss of sense of smell. There are all those symptoms. But the main things, problems breathing, fever, definitely the hospital, definitely ASAP.
And they're saying that when you really can't breathe, in terms of the distance between each breath that you take is unbearable. That's when you
it's more of just rapid breathing. Rapid breathing. There's any difficulty, and I wouldn't. It's just as simple as you're not breathing properly. Then you've got to go to the hospital, because breathing is quite important. You're not getting the oxygen to the brain, you're not getting oxygen to the body, so that's quite important. And fever as well. Those are the main two things, if it's really bad and uncontrolled.
Okay, wow. Gosh, well, thank you for those. So if you're listening and you just heard, those are the real symptoms to look out for, and it gets really bad, you need to get yourself to the hospital or something, or whatever. And by the way, if you have any questions for for Andrew, do you put them in the comment box and then we'll try and read them out. So if you've got any questions or anything that, you know, you might be worried about, we'll try and get Andrew to answer them for you and whatnot. So now that, you know, you have to do serious surgeries and with your trust, you see a lot of cases coming into the hospital daily, and, you know, because they seem to report a lot of the amount of infections that are rising every day, and of course the death. But are the true numbers that they're reporting, is that a true reflection of what is actually coming in the hospitals daily?
I think nowadays, you know, there's that thing about people with a lot of medical problems.
Yes.
More predisposed to having COVID. And it's kind of true, because when you're in hospital, you got lots of medical problems. We tend to want to test most people now. And so there's a separate box. There's a separate box even on the electronic medical record. Immediately a patient comes in, we want to know, is the patient positive or negative? And yes, there's been an increasing number of positive cases. I think the positive, however, is the fact that because people are staying at home, there are less things like head injuries, road traffic accidents, spinal injuries to the spine, you know, things like that. So in a way, that is much better. So I went past the accident and emergency the other day, and it was very quiet, and I've never seen it that quiet in my life. You know?
I used to.
So I think that's a good thing, because you think about it, if infection was going to spread in the hospital, it would probably be in the accident, in a packed accident and emergency.
Yeah.
So that has really, you know, been helpful in terms of, you know, when people stay at home. So that's quite good. Yeah. And that's why the message is being, you know, propagated every time.
Yeah, definitely. So for you, and like, obviously this is all happening, how are you coping with it, like, you know, personally, like your mental health, because mental health is a big thing these days, and even from surgeons or any doctors, like, how is your mental health in all of this?
It's been good so far, to be honest. I'm getting a bit bored now, so, you know, because I just want to operate most times. So there's a certain degree of boredom setting in. And then it's just the fact that things change a lot. So you have to keep abreast of what's going on. So in my trust, they're like, keep an eye for emails. We have regular updates and sessions, the regular meetings with the clinical management staff, just to know what are the new things that we need to do, you know, then any new changes that we need to make. So that has a certain level of stress that it adds to you. You know, sometimes you tend to think about your patients who you've not been able to operate on. You're like, what's going on with them? Are their symptoms worse, or are they just, you know, what's happening to them at home? You know, things like that. But overall, it's not been too bad. Yeah, someone's just put a question there that have I been redeployed to critical care? Not totally, because the way it is we've had to change the way we work. So some of our colleagues have been redeployed, while there's still some of us who have to man, you know, pretty much the neurosurgical department to make sure that things are at least happening. But overall, in the trust, there is more concentration towards the medical teams and the critical care teams. I haven't been redeployed yet, but, you know, I'm trying to, like, get myself, you know, pretty much prepared if, you know, finally it gets to me in terms of you know, the things I have to do, because a lot of those things I haven't really done in quite a while. Yeah, because, you know, I'm a surgeon, so I operate and manage patients from a neurosurgical point of view. So it's all about helping, and you have to fit, you know, pretty much the right pegs into the right holes, you know. So that's pretty much part of what has been taken on board by the trust. So everybody's helping in whatever possible way they can, you know, in terms of the meetings. We tend to have regular morning meetings so we can, choose, what part of the hospital needs help, theater, what cases are being done. We might have to close this theater so that this is being done, things like that. So a lot of work every day. Yeah.
Yeah. Okay. Someone just asked, how do you feel going to the front line with the looming PPE shortage? I think you've covered that already.
Yeah. So that's so far we've not had a problem, but we have, like, today's meeting was about that. So we're thinking, should we have to sterilize? We're trying to get like an extra autoclaving machine so that some things that can be sterilized, we can sterilize. We have there's been a local company that's helping with some 3D productions. So 3D printing. So there's been a lot of work to make sure that, and what we do now is teams. So sometimes some people will do more of telephone clinics, and half of the team are fully on ground so that if someone falls sick, you get someone pretty much on the bench, using a football analogy now. So you call them up, you take this person's position, this person goes home. So there's a lot of that's happening. We try to minimize as many people as we have. So we don't have the big meetings anymore. A lot of things are done online. I found it odd speaking to my patients over the phone because there's something about when you see a patient in clinic, even the body language can give you a lot of information. So how is the headache? How is the leg pain? The body language, it's like there's something I read in psychology some time ago that a lot of our communication is based on non-verbal cues. So it's been quite odd trying to, change and talk to people and trying to glean a lot of information. The one positive with telephone clinics, however, is that they're much shorter. So you see so many more people.
They don't need to come in and be talking for like half an hour.
No. And I also think our patients are also scared, genuinely scared. They don't want to be in hospital because of COVID. Rightly so. So that is also helpful.
Yeah. Okay, so another question says, with the surgeries that you are able to do, are you swabbing and testing patients for COVID-19 just in case they have it? And are symptoms are they symptomatic, or is it just standard procedure yet?
Yeah, so that's part of it. We do that, but for us as surgeons, what the Royal College has said is you treat every patient you operate on as if they're COVID positive.
Right.
So now, since last week, we had, because initially we were categorizing patients based on, this patient is negative, this patient is 50-50, this patient is positive. But now we've been told that every patient, we are supposed to treat them like they're COVID positive. So it's more stressful, it's longer, but you know that you're saving more lives, yourself included, by doing that.
Yeah, awesome. Oh, wow, good. I guess it's safer to do it that way than think that that they're not. So
exactly,
and whatnot. Okay, so I know because you've got to go and we've got to wrap up quite quickly as well. What is your talk about your faith real quickly? Like, how has this process? Because I've asked all my guests about how being in this pandemic, and obviously in the line of work that you do, how has it affected your, your spiritual life, your walk with God? Because that is obviously going to be tested even more now than ever.
I don't think it's changed. Like I told you, it's neurosurgery on its own is challenging enough. You have really bad cases. Sometimes you see, families or friends pray about their cases, and deep inside you're like, oh, no, nothing's gonna happen. So it's an everyday thing. I don't think this has made it any different for me. I try to pray before every case personally for me, and a lot of people around me don't even know I do that, just because I'm like, well, I want everything to go well. I want everything to, go safely. I don't want to have a complication. I want, I tell patients and their family members before I operate, and I say, oh, I'm going to give you a call immediately after telling you how it went, and I want to be able to give you good news. So as much as possible, it's not really changed. The COVID thing hasn't really changed anything per se, for me anyway.
Yeah, I mean, that's true, because I think some people, it's forced them to rethink about how their connection or their relationship with God again, and is it questioning everything, like, why is God doing this? Is this God?
No, I don't. Yeah, for me, I haven't looked at it that way, and that's why I told you that putting on my medical cap, or maybe not even a medical cap, I am someone who's always known that epidemics, pandemics tend to happen every time. If you look at, everybody's been talking about Black Death, swine flu, Spanish flu. They've happened, several times. They might be different to each other in some degree. The problem with coronavirus is it's a pandemic, so it's like everywhere.
Yes. Well, yeah.
I know someone was saying, oh, how is a pandemic different from an epidemic? And someone say, oh, because of the P. It's a pandemic with a passport. And that's what coronavirus is. So it's an epidemic with a passport, because it goes from Wuhan to Italy to South Korea to Lagos to London. That's pretty much it. But it's happened every time. So I don't look at it as being different. I just think the world has become more of a global village, and the social media. So we're hearing things. There's like so much information.
It's just like, it's just too much. Okay. All right. So we'll take this last question. It says, is it hard to switch off from COVID-19 oversaturation at work and try to focus on the word of God and remembering what God says? Because there's a lot of information, and also because of the information that you receive at work and factual, scientific, etc.
Okay. Now, if asking it like that, I kind of see where this person is coming from. I see what you mean, because it's just so much, isn't it? You don't know what's going to happen here. You're trying to watch everybody, and like I said, that my clinical director was like, I want everybody to be, because at the back of your mind, it's there, isn't it? We don't want to lose anybody. We don't want to use anybody close. So I get what this person means. I guess so. And that's why for me, when I'm away from work, I want to be away from work. What I've started doing now is I look through my contact list and I try to call my friends regularly, because I'm like, even if I am dealing with things in a better way, I don't know which friend might not be dealing with things as good as I am. So I'm trying to call people. What I did last week was to call other colleagues who are in the front line, who are even more involved than I am, just to check how they were doing and stuff like that. So sometimes it's difficult, but it's all about detaching yourself from it. When I'm in the hospital, I'm in the hospital. Everything about me is in the hospital. When I'm out, then I try to do other things. Switch off, meditate, pray, Netflix, family, all that kind of stuff. Zone out.
Okay, cool. Wow, my gosh, very, very insightful, indeed, as to your line and how where you've had to be placed, or you continue to do what you're doing, because I guess only emergency surgeries are going ahead at the moment, and any elective ones have been stopped. So you're just focusing on one. So I know what the message is for everybody, but like, what do you really want people to understand at home, like, and take away from this, like, this whole thing that's going on? Like, what is it that you want to say to them?
I think this is just the time to really treasure the things that really matter. It's we're kind of forced into some kind of introspection, isn't it? We're just forced to stay at home and think. That's really what the whole process has shown us. We were talking the other day, and we're like, one of my scrub nurses, I was operating yesterday, and one of the scrub, I love football, and everybody at work knows I love football. And the scrub nurse was asking, so how have you been coping without football? And I was like, you know what? If you'd asked me this years ago, I would have said there's no way I would have survived. But for some reason, I'm surviving without football. It's like, It's so
You can do it. You can. You can be done.
That's not what a lot of guys want to hear. And I find myself going on the football websites, and there's not much information. It's just so boring. There's nothing, and everybody's, I'm an Arsenal fan, and they're talking about legend of the day. Oh, Thierry Henry. I'm like, give me some football. Oh, God. Anyway, what can we do?
Right, totally. Oh gosh. So yeah, I guess the big message is, people just really people just need to stay home.
Yeah. We just have to, so that COVID pandemic can be over as soon as possible.
Right. Okay. Yeah. Definitely. So yeah, I really hope people take it seriously, because the longer they stay out, the longer you will be inside. People they won't lift the lockdown. That's the thing. And then the more business.
Absolutely. And I think there were a few whispers from the grapevine today that it might be longer than they said. That's what we were hearing earlier today. But we'll see.
Right. Okay.
We'll see how it goes.
We'll see.
So stay home. Tell everybody. Stay home.
There you go. Stay home.
Absolutely.
Right, so if anyone wants to ask you any questions, about what's going on right now, and I'm sure there's not everything you can answer, but whatever you can within your capacity, how can they get in touch with you to do so?
Oh yeah. So I'm pretty much active on the social media platforms anyway. So this is my handle here. It's Andy Neuro1. You could send me a message. It's not one of those padlocked accounts, so you can easily send me a message. And I know, right? I know. And I'm active on Twitter as well. So it's AF Alalade on Twitter. So at AF Alalade. And yeah, people can send me messages on that as well.
Brilliant. Well, Andy, thank you so much for joining me today. I mean, it's been so good just to have an insight on, on what's happening in your world of, of medical, and how you've been able to cope and navigate this whole thing. So thank you so much for sharing it with us. And I know
no problem.
Look, this is how real it is, guys. He's in scrubs. He's in hospital right now, and he's taking time.
We've all planned that every time we come in the hospital, we're just gonna be in scrubs, so that when we go, we just change back into house clothes, clean up, and that's it. So that when we're in hospital, we don't, we're not carrying the bugs.
Carrying up and down.
So that's it.
Oh, that's brilliant. Well, thank you so much for joining me. And
Lady T, thanks for the opportunity. It was
honestly,
fun
it was my pleasure. And thank you so much again. I really appreciate it. And I just pray that God continues to protect you guys and the rest of your team. And you guys are doing great work, and we really, really appreciate every single thing that you do. I think this season has taught people not to take anybody in the medical profession for granted ever again. Never take them for granted, because they're doing their work, and they really are saving lives out there. So we appreciate you a lot.
I appreciate that. Thank you.
Cool. Thank you so much.